You may have seen the article in the Montreal Gazette, and I think it's fair to say a couple of articles anyway, over what's going on with Quebec healthcare when it comes to job cuts specifically. Now, I think we can all remember back when the health ministry announced, when they appointed Geneviève Biron as the head, of course, that there would be $1.5 billion in cuts that had to be made. I don't think many of us expected those cuts would be of the rank and file, people actually doing the work, but it seems that's exactly what's happening. Jacob Serebrin is a reporter with the Gazette. He's been on this story now for a while. And Jacob, your story most recently talks about those cuts specifically as they're going to affect the West Island, right, and the healthcare out there. So let's start with that. That's about 150 jobs. As I said, these are people on the front line, though.
Yes, yeah, that's right, Aaron. So what the health authority that manages healthcare in the West Island, and so that includes, the Lakeshore Hospital, Lachine Hospital, they say they're going to be cutting 160 positions in all areas, both administrative and clinical, as well as reducing the number of management positions. And so that health authority, the CS de l'Ouest de Montreal, has a budget deficit of $80 million. That's about 6% of its annual budget. And so it's making these cuts to workers. It's also reducing overtime, bonuses that are paid to workers to be available on call or at certain times when they need additional staff. They've also canceled some replacement assignments. So workers who were covering for colleagues who are on maternity leave or disability leave, some of those jobs have been canceled now. And this comes at a time when I think the Lakeshore Hospital especially is under quite a lot of pressure. There was a large urgent care clinic right next door that recently closed after it's the company that owns it went into bankruptcy protection. So a lot of pressure on the healthcare system there right at a time when workers are being cut.
So you're talking about 160 jobs, as far as the West Island is concerned. We're understanding there's 1,500 jobs so far that have been cut across the province. Is that accurate?
It looks like you might have more newer numbers than me. The last time I looked, it looks like 1,000, but it's probably more than that by now because all of these cuts are going on. And this is part of the problem, is that even though the provincial government has centralized Santé Quebec, centralized the whole healthcare system under this Crown Corporation, Santé Quebec, the cuts are still being made by sort of the regional health authorities, by hospital networks. So Santé Quebec sort of at the high level says, well, we're going to cut $1.5 billion, and then they're putting it down to the agencies that provide services on the ground saying, well, you figure out how to find that money. And so that means it's job cuts here, it's job cuts there, and it's one thing we're trying to do right now is put these pieces all together and go to each health authority, hospital network and say, well, how many people are you cutting? How many people are you cutting here? And Sans Sud in Montreal, which is a large CS, runs a lot of healthcare programs. A lot of the sort of centralized stuff for the whole city is run out of there. They said they cut 50 jobs in November, another 123 jobs eliminated, vacant positions eliminated in November, though they're also hiring some people as well at the same time. So it can be hard to keep track of exactly what's going on. We're trying to all put those pieces together.
Do we have a sense of how or if this is affecting patient service? Because I know the answer from Quebec typically is, well, this shouldn't affect service at all, but that seems highly unlikely.
Yeah, it's tough to tell right now, and it's something that we're definitely looking into. I was talking to one of the vice presidents of the nurses union, the FIC, and she was saying it's all interrelated, right? So you can, if you cut someone at one place, even if it seems like, oh, maybe that's not going to make such a big difference, everything's so interconnected that it does have an impact. So, one thing we're seeing right now, one of the reasons our ERs in Montreal are so overwhelmed is that they can't get people out of the hospital. So people who are, able to go into another form of care, get some home care, go to a long-term care center, they can't be discharged because there's no resources for them. And that leads to sort of a bottleneck, a backup, and so people are in the ER because they can't get transferred to the ward because someone's in the ward who can't get transferred to long-term care, or because they can't go home because the home care they need isn't available to them. And François Ramel, this vice president of the nurses union, was saying, this is what's happening, that this is going to get worse with these cuts because they're going to cut home care, they're going to cut mental health resources, they're going to cut these things that seem like they're not as related to sort of the urgent care, but it has this, it sort of has this feedback effect that, once you cut one thing, it's also interrelated. So we're going to be watching that very closely.
Okay. We talk about individual areas that have been affected by this. I know we're going to talk to someone at the Douglas because they apparently are one of the institutions being adversely affected by this. Listen, I thank you so much for the time, and I appreciate it, and terrific job. I hope we can follow up on this later on as well.
Excellent. Thanks so much, Aaron. I'm glad you're looking into this as well.
Jacob Serebrin over at the Montreal Gazette. Yeah, and I mentioned, of course, areas specifically being affected. The Douglas is one, but then there's this story that kind of came up the other day, and I saw Paul Karwatsky post about this. Speech therapists. For a lot of people with children who've been relying on speech therapists, well, these job cuts are affecting them directly. Marie-Philippe Rodrigue is a speech therapist and president of the Quebec Association of Speech Therapists and Audiologists, and she is on the line. Thank you for being here. I know you you posted an open letter in the Journal de Montréal yesterday. This is directly affecting you, is it not?
Yeah, exactly.
What's it meant? Are we talking about people who are losing jobs or services not being offered? What does it mean specifically?
It's kind of both. So some speech therapists lost their jobs, even if they were working for they've been working for a long time. Mm-hmm. And what happens is that for the people who lost their jobs, the others that are left, they have to fill in the gaps, and so they end up with just wait lists that are never-ending wait lists. So they have to put mostly children, back on these lists. They have to prioritize and to review what's going to be treated first. So, and some children won't receive any treatment. So, yeah, it affects a lot of people.
So we understood. I mean, there was already a fair waiting list, but does this mean that parents who had already been receiving treatment from a speech therapist services are now just pushed down the list again and don't know when they can get a speech therapist again?
In certain cases, yes, depending on the environment and on what are the resources left. But some might, for example, they had a bunch of treatments, and then they're on they have to go back on the list, and then they have to wait, even though there was another bunch that was due freezable in 3 months. They have to wait a little longer because we have to prioritize, and the ones that are less, they have less difficulties. Well, it will be longer for them, so some won't even have any service.
So you obviously, I mean, we hoped when we heard there were going to be job cuts. Well, I didn't hope, but we assumed they might be at management levels, not actually, rank and file. And it's turned out to be exactly the opposite for you. Have you heard from the government as to your particular situation yet?
No, not yet, unfortunately.
So you don't know where this is going to go. How many people are affected specifically within your organization?
We don't know exactly the numbers, but we know that it's not the article we just published was for the Suisse de Montréal, West de l'Île, but we know other regions like in Montérégie, in Gatineau, but we don't know the exact numbers yet.
And you also don't know, I guess, if that's the end of the cuts.
No, exactly. We don't have any idea when this is going to end. And it affects speech therapists, but, for example, social workers, because we know that it's mostly about mental health for the youth. And we know that children with developmental language disorders have many other issues. So it's not only about the speech therapists that are left on the field to fill in the gaps, but the other professionals too, so social workers, occupational therapists. So it's larger than just our own field of practice.
I would just ask one last question, which would be, what would your advice be for parents now who've been using services? What should they do? Is there anything they can do now that people are, been cut?
Yeah, well, actually, we say to parents to stay on the wait list because of the statistics. So the numbers speaks for themselves. So it's important, even though they know that maybe they won't have any help, just to put their names there. It speaks a lot. And after that, if sometimes we have other resources like in the community website that can help give you a few resources If they need help, they can call 811 and the social line,
Okay.
so to know where to go and have more information. But just to stay on the waiting list will help to show that there's a need and that's not answered.
All right. I thank you so much for your time, and let's hope we do get some good news here. A lot of parents feeling very let down by this. Marie-Philippe Rodrigue from the Quebec Association of Speech Therapists and Audiologists.